Well, let's talk about all of this with Sir Iain Duncan Smith. He's a former Conservative Party leader, of course, and joins us now. Good morning to you, Sir Iain.
Morning, Julia.
Look, this has been a very difficult time for everybody. We went into a 3-week lockdown in March. Here we are in the middle of a 4-week lockdown. We're going to come out of that into yet more restrictions going all the way to next March. We are talking about a whole year of restrictions on our lives, a whole year of dealing with a pandemic, and a whole year of dealing with lockdowns in name only or in reality for many, many millions of people. What did you make of what the Prime Minister had to say yesterday and his reasons for bringing in those new restrictions?
Well, first of all, I thought there was a very important thing he made right at the beginning of the statement, which hasn't really been picked up. And it was he admitted yesterday, finally, and which means that his scientific advisors admitted that the tier system had an effect, a strong effect, on bringing the R rate and flattening it and bringing it down, and then went on to say, but that's not enough. But the point was, for the first time, we actually had an admission that what we've been arguing about now for some weeks is that the tier system was working, and it may not have been working as speedily as they wanted, but it was working. That's been denied endlessly every time we've had a discussion with the officials, etc. But for the first time, he did. Secondly, it means, therefore, that at the weekend, when we saw the figures beginning to really flatten and come down, the claim that the health department made that this was clearly down to the lockdown was also untrue, because it was quite clear from what the scientists said previously was that you wouldn't see the effects of those until early this week. So the effects were of the tier system. We still haven't seen the effects of the lockdown, and that's the important point, because they're introducing now a much tighter tier system where literally you're going to sort of be shunted upwards. So anybody in tier 1 is almost certainly going to go into tier 2. Tier 2 will either be tightened up internally dramatically, or you will go up into tier 3, and people in tier 3 are going to be tightened up, so it's a quasi lockdown, almost except in name only. So the reality for us, I think, is that this was in a way a disappointing statement, because it's not based on what we know is happening with the lockdown and how deep that will be. And for the hospitality industry, this is an absolute hammer blow, because this is the most important part of the year for them. And they are probably the safest area of all.
And we know that the evidence is really clear that people, the government knows perfectly well, people are going to be mixing over the holiday period. Some people, whether they like it or not, it's much safer for those people to be mixing in COVID safe areas, in pubs and in restaurants, than it is for them to be at home, less ventilation, not COVID secure, people mixing much closer. And this is the key thing, isn't it? We were told, as you said, when we went into the lockdown, it's because the tier system wasn't working, even though we actually had already seen it. It's very, very clear now that infections were levelling off and actually going down in some of the hotspot areas. And now we're told, that's the lockdown effects. And as you say, it is a physical impossibility for that to be the case. But the reality is actually the lockdown effects weren't felt uniformly. So even all those in tier 3 or all those in tier 2 did not act uniformly. That would suggest that the figures were going down regardless of the regulations put into place. Because if it was closing shops or closing hairdressers or closing pubs that had this effect, that effect should be felt uniformly across the nation, and it isn't, which suggests that the vaccine was already on its way down from the peak of the second wave at the point before we went into some of these, certainly the tier 3 restrictions for some people, but certainly also the lockdown.
Yeah, there's a number of scientists, Hennigan and others, who believe that was very much the case once people realised what was going on in their area. As your previous caller or whoever was on the call, I'm afraid I only caught it late, was saying just then.
Yes, Professor Anthony Brooks, yes.
Yeah, Professor Anthony Brooks, I apologise, was saying that people are by and large most people are making clear decisions about who they see and who they don't see and what they want to do. And I think that was reflected much in the nature of this. So my concern really, I think, in all of this is that we have to be very careful. The economy doesn't feature in any of this really at all. And whether we like it or not, the economy is vital to how we can proceed and even pay for half of these things. And so trying to find a way of keeping as much of the economy open is absolutely vital. I mean, the West End, for example, puts about 4% back into GDP, just the West End alone. That's dead, completely dead. It's been dead now for months, even during the air time when we opened up. Half the reasons for people coming over were not there, so people aren't travelling and the money's not being spent. And these are not just, features of the economy. These are livelihoods, lives. Many of them are small businesses.
This isn't someone having a fun Saturday night. This is actually... But this is the key thing. Mark Harper, one of your colleagues among the 70s COVID Research Group MPs, he asked the Prime Minister, annoyingly at the point just when the Prime Minister's broadband failed, rather conveniently, halfway through his answer, he asked the Prime Minister for what to know. He says he wants to know what the impact of each measure, so the decision to to close this particular sector of the economy, and each measure is on each tier would be on COVID, and what the expected impact would be on people and their lives and on businesses. Now, these are very specific questions, and one would expect that any major government policy, given the number of civil servants we've got working on this, all the computer modelers, all the statisticians, all of the experts on stage, that they would have evidence. So if they say, no, well, we need to close these shops, or we need to have this particular sector closed, that they must have evidence for why that closure is justified. So there's a cost of that closure in terms of the effects on economy and long-term economic and health effects of that, but also what the benefits would be. We've never seen any of that. Now, your group of MPs, 70 MPs, basically saying unless we do see cost-benefit analysis, we're not willing to vote for a measure that we think is basically without evidence. We're not seeing any demands from that from most Tory MPs, and we're not seeing it from any of the opposition parties. Even Sir Keir Starmer hasn't asked to see the evidence. Does that stun you, that MPs are willing to vote to have extraordinary measures affecting the economy, people's lives, people's freedoms, without any evidence whatsoever?
Well, I must say, this is the first time I've ever been involved with government, and I ran a department for 6 years, that where you haven't had the demand and had to meet the demand that there is this cost-benefit analysis that takes place, winners, losers, the balance overall, and other effects.
That is routinely done in government, isn't it?
It's absolutely routinely done in almost every area, and particularly the bigger the area, the more Treasury and others will want to know the answer to that question. And so it has to be fairly rigorous, and there are all sorts of tests that you have to apply before every decision is made. What's changed about the nature of COVID decision-making, it's been made very much in a small group of people, amongst a small group of people. And to begin with, it wasn't even debated in Parliament. It's only quite late on that we've actually debated some of this in Parliament. But because the Labour Party chooses to absolutely just support it without any real serious requests about how this information's been arrived at, the government doesn't produce this information. Now, I don't know whether they're doing it internally or not, but if they are, then I think it should be made public because it's important for people to understand. And this is the question, really. We know that as much as we can see, most of the evidence is that transmission takes place mostly in the home at the most serious levels. We've seen a lot of the rises due to groups meeting together for functions. But where you have a proper controlled environment, like many of the restaurants and pubs are doing, clean down all the time, making sure people are in the correct groups, not moving, making sure that they're wearing masks, all these things. These areas can and should be open and allowed to continue to trade because they're not great vectors of the virus. And so getting some balance and in an attempt to get the economy going, you get the feeling at the time that some of these decisions are made without any regard to the economic impact of this at all. It's as though the economic impact is a given. Oh, well, it's going to be really bad and we're going to get stuffed. So economically, there's nothing we can do about it. Let's just get on with it. And I don't think that's the right attitude. I think the attitude is that, with borrowing absolutely spiraling right now, and I mean spiraling, this is the first time in hundreds of years that our borrowing has exceeded our income dramatically. Our debt, that is, and it's going to rise. We haven't even seen the effect of the second lockdown yet.
No, indeed.
And that's the key. So I really do think it's only fair and reasonable that we get to know what is the balance of economy versus lockdown and where was the decision. Why was the decisions made about certain areas on economic and health reasons.
And crucially, of course, the economic effects will have a knock-on effect in terms of people's health.
Oh, yeah.
Just finally, the Prime Minister said, "'Tis the season to be jolly," talking ahead of Christmas, but it's also the season to be jolly careful. Do you think that the British public need to have rules about how many households they can meet and in what circumstances when it comes to meeting their perhaps vulnerable elderly relatives or meeting other households over Christmas? Do you think we need to be told what we can and can't do? Or do you think we're capable of making those sensible, rational, loving decisions ourselves?
My answer is I think most people will make a rational, reasonable decision. You will always get groups of people that don't care and won't make a rational decision. So I guess if the government wants to get this sort of clear, then guidelines are very, very important. My slight worry is that there is now a very strong set of rules now being applied in what's called the winter rules. These are just been published, and they are very, very severe. It's giving huge powers to local authorities to intervene, to fine, and to basically try and get inside people's normal lives. And I think that is a mistake. I don't think that's necessary. I think in certain areas you still have enough power to deal with people who willfully won't help and won't deal with this in a proper way. But generally, most people are going to try and deal with this sensibly. I've always felt that, because otherwise you haven't got enough police in the world to be able to police people if they won't deal with it sensibly, and the local authorities won't be able to impose anything. So we go along with policing by consent, government by consent, and the moment we start to abandon that, then the public themselves start to abandon reasonableness as well. So we need to balance that carefully as much as we need to balance the economy, the economic effects, the broken livelihoods, the failure to get other treatments, and other deaths that are due to the failure for hospitals to be able to deal with them. And also, I really do want these figures about the death rate investigated, because the other day I had somebody I knew for a long time, an old chap who had a bit of dementia. He went into hospital, tested, perfectly clear of it. A day later, apparently, he was tested, but they said, don't worry, he's asymptomatic. And the following day, he died. It turns out that he probably died of a heart attack, and he'd been taken off warfarin for reasons that they were obviously worried he might have fallen. But that's gone down as a COVID death. And my point about this is that we really do need to understand, as Germany does, specifically how many people have died of COVID, as opposed to people who've died who had comorbidities, which is the killer area.
It's definitely all going to come out in the wash, I'm sure. Very sad for your loss of your friend. Sir Iain Duncan Smith, thank you very much for joining us. It's 8:20.